So, in regards to after we spoke today, I wanted to make sure that you were able to go to your appointments with this, your oncology provider and at Mercy Sportsmith and your nuclear med provider for the Lucera injections, your radiation injections.
The appointment for this Thursday in Fort Smith has been canceled.
The 7th?
Yes. Now, I will tell you this.
With your palliative care provider, correct? I've reached out for your Lucera injections, which is your nuclear medication department, and your oncology department is who I've reached out to for the 13th and the 21st.
The appointment for this Thursday, and I got to be forthright with you, it was canceled. Transportation had to be canceled because they decided it's going to be a telephone conference.
So they're going to make that a little easier on you.
Yeah, it's an appointment with a nurse as a follow-up to the appointment I had with the doctor. So they do this video stuff, and they'll watch you. You have to show them your pain meds, and they'll ask you, is there anything you need, and all that stuff. But I will tell you, so you reached out to nuclear medicine, what did they say?
Well, the nuclear medicine will call me back tomorrow because the provider is no longer there. But I also spoke to your oncologist who said that it will not interfere with your chemo treatments, and that you should also, they said you need to see the dentist first when we discussed this. So we don't over-medicate you considering and causing additional problems with the antibiotic-resistant bacterial infection that could negatively impact your health.
Here's one thing about it. And by the way, when you talk to all these people, there's a lot of miscommunications in terms of who to get a hold of. Because I've discovered that, like when the idea about this, the first time about lodging, there was another situation about getting a letter. I had a surgery that was here in Muskogee that canceled because of anesthesiology canceled because they hadn't heard from nuclear medicine. And it was really aggravating. I want to get to the bottom when they told me they would send a message. They get mixed up who to actually send it to. The other thing, when people contact Little Rock, sometimes they might want to, instead of the nuclear medicine, they contact the oncologists over there. And then the other thing is, I don't know if you know this, but I need to do some checking on this. They get mixed up, and somehow Fayetteville always comes up. And I was told, and I'm going to verify because I don't know for sure, that if you're referred from out of state to go somewhere in another state, now I just don't buy this, but someone told me, VA, it's up to they don't even make sense. I'm not even going to say, try to tell me that it's up to them to pay for it. And I don't believe that because one, I'm not in the, I don't know, but what I'm saying, you have to be real careful, and then found out that because this came up with about a letter, sent a message that it's okay to have this surgery, and but no one knows where it went to. So now anesthesiology here wants me to get a hard copy when I go over there. But I will tell you this, I mean, I don't know for a fact, and Doug is the supervisor over he's one that administers the nuclear stuff. They always have him, and then they'll have a nurse that gives me the, I forgot what that IV is, and watches me and all that stuff. Amino acids.
The Eleuthera injection?
No, a nurse can't do it. See, I like to learn from these people. She gives me the IV, the amino acids. Doug is a nuclear, I forgot the title, and he's over that department. He's the one that comes in and actually administers the radiation and part of it. And then, of course, the nurse, watches you, monitors you, and all that kind of stuff. And, of course, when you got to go to the restaurant, oh, my word. I'm glad I got the pens now. It's not, because you got to be unhooked, or, just like if you was in the hospital, and you ain't going to make it. That's why they give you paper uniforms to wear. Anyway, but the thing about it is, I don't know if you saw my message I sent.
Yes, sir.
This is, I'm going to use layman terms, this is ludicrous.
Well, this is why I've contacted them and confirmed that we're taking the correct actions. We talked to your oncologist office, and I used this number, 479-314.
Right.
7490. That's how I contacted them. If you have any concerns about that, you can also use that number and reach out to them.
Okay, what'd they say? And I know what they would have said.
Well, wait, and then let me finish, and then we'll go back to you, okay, Mr. Hudson? And then Dr. Wong, the nuclear medicine provider that gives those injections, his office is going to reach it back out to me tomorrow. However, his nurse did not see a problem, but we are going to confirm, and they will call me tomorrow once they've spoken to him as well. Your oncologist office says that it won't interfere with your treatments, and they say you need to go to the dentist and be seen as well. And like I said, I have that number you can contact them back at. I have consulted the social worker concerning dental providers that would be fiscally feasible and help you with that, so they should be contacting you soon. Also, since you mentioned suicide, I want to check in and see if you're suicidal by doing this Columbia scale for your safety, if that is acceptable with you, Mr. Hudson.
I was wondering how long it would take, because an incompetent nurse manager and intercepted a message I sent to the urologist, who never even got the message, and assumed something. And it's believed that she, who I've never met before, took action based upon retaliation because of another nurse, a student nurse. But anyway, and what she did, she actually committed possibly a federal crime in assuming things. Because one, she never contacted me to ask what I meant and stuff like that. But I'll tell you, what those concerns is, no, I'm not going to go into subject matter of suicide. Did you read the words verbatim of what I wrote?
I did read them, but because you did reference suicide, even though you did not say
simply because I reference,
I have to check in and make sure you're not. But if you will not refuse, okay, that's fine. But I have to check.
What I'm going to do, I'm going to invite you. I'll send you a message, and when it's the Talking Better Radio Network, and I've done interviews with all kind of big shots, even the suicide hotline. I've arranged for interviews, how that works, this and that. I've interviewed. I did a series one time about suicide, the front end, the back end. There is organizations like in Arkansas, We Are the 22. They actually work with law enforcement intercepting. And this comes under one of those kind of situations where I have seen a lot of veterans. And when you start looking in these situations, and these veterans are basically being denied medical treatment because of some bureaucratic disposition amongst, like in this situation, you call an oncologist in Fort Smith. They, wait a minute, let me talk. Let me talk. I've been through this so many times, not me personally, but for other veterans too. The problem is with a lot of these veterans that a lot of it is bureaucracy. It is the system. And Colin, I know what an oncologist in Fort Smith would say. I know what other people would say before you even try it, because I've tried it before. Everybody wants to put you off and not understanding your history, which I know very well, and then come up, with something about you got to go to the dentist. But the thing about it, that doesn't relieve the immediate problem. And I've had an oncologist at. Wait a minute, I'm not.
No, sir. Thank you. We will consult the social work to advise you.
Hey, wait a minute. You're not going to be rude. And by the way, you are being recorded for the Veterans Radio Network. I want to thank you for your, but this rudeness, you don't even want to help resolve the issue.
You're the one that escalated this situation with yelling. I tried to
I'm not yelling. I'm not yelling.
Yes, sir, you are.
No, you're accusing me. I tell you what, this has been recorded. We'll see who's recording. Yes, no, it's legal. You will be on the radio network. Thank you.
Thank you.